My name is Stephen Hadfield, and I'm from Matthews, North Carolina. I am 71 years old, a husband, a grandfather of 3, and a football fanatic. I also live with a rare blood cancer and type 2 diabetes, 2 health conditions that require very expensive drugs. Every month, the treatment I need to stay alive costs $16,000. At times, I've had to forego or ration some of my drugs because they are just so expensive. No one in America should have to live this way. For too long, drug makers have made a fortune while patients like me live in constant fear, wondering how we pay for our medicine. Thanks to President Biden, that's changing. He's finally ending big pharma's one-sided pricing power and giving seniors like me a break. But it's not just me. His actions are literally saving the lives of so many other patients and families across the country who are struggling to pay their medical bills. He gets it. And that's why it is my greatest honor to introduce the man responsible for all these incredible changes, President Joe Biden.
Today is the start of a new deal for patients where Big Pharma doesn't just get a blank check at your expense and the expense of the American people. On my watch, healthcare should be a right, not a privilege in this country. And unlike other parts of the healthcare system, Big Pharma got a special carve-out that stopped Medicare from negotiating prices of drugs through Medicare. For years, advocates like many of you in this room have worked tirelessly to change that and give Medicare the power to negotiate lower prescription drug prices, just like the Department of Veterans Affairs does right now. It matters. VA pays 50% less than Medicare can and negotiating the same lower prices. For years, Big Pharma blocked this. They kept prescription drug prices high to increase their profits and extend patents on existing drugs to suppress fair competition instead of innovating. Playing games with pricing so they could charge whatever they can. But this is finally, we had enough votes by a matter of 1 to beat Big Pharma. Well, we did it. When we act, change happens. You know, and today I'm proud to announce that Medicare has selected the first 10 additional drugs for negotiation under the Inflation Reduction Act. 10 additional. Drugs that treat everything from heart failure, blood clots, diabetes, kidney disease, arthritis, blood cancers, Crohn's disease, and so much more. Medicare spends $50 billion a year on these 10 drugs. And American seniors are spending $3.4 billion on out-of-pocket costs. Last year, the industry spent $400 million in lobbying fees to try to stop the Inflation Reduction Act and block the ability of the federal government to lower drug prices. And when they failed, they went to federal court to sue the government in an attempt to maintain their exorbitant prices. They're hoping the courts will do what Democrats in Congress wouldn't do: protect the exorbitant profits and keep negotiations from happening. But we're going to see this through. We're going to keep standing up to Big Pharma, and we're not going to back down.